Hello, everybody. Welcome to Chapter 5. So in this chapter, we're going to be talking about the chemicals and methods that can control microbial growth. In Chapter 4, we talked about how microbes grow and the different nutrients they need. Now we're going to talk about how we kill microbes. So before I start, I just want to remind you about Joseph Lister. He is an individual who came up with the carboxylic acid machine and started spraying the table and the instruments that are used in surgeries. And this actually saved many individuals' lives. He did this. He was looking at Pasteur's work. He looked at Semmelweis's work, and this is where he came up with this idea that maybe we should be cleaning the environment, washing our hands. He also had or started the process of changing sheets between patients. Prior to Lister, a patient would be put in the same bed as someone who had just died. They didn't change the sheets. Obviously, if there was a bunch of blood or material on the sheets, then they would put new sheets on there. But they didn't change sheets regularly. So this improved the operating environment, this improved the hospital environment, and saved millions of, I'll say millions of lives. I mean, at his time, he saved thousands and thousands of lives, but because of him, we have changed our method of treatment in hospitals. The oral antiseptic Listerine was named for him, and it was initially used as a surgical antiseptic. Before the late 19th century, the late 1800s, patients undergoing any type of surgery were at a very great risk of dying. And so people didn't get surgeries for any reason unless it was life or death, because otherwise they would likely die. The reason for these deaths was because a lot prior to the late 19th century, doctors didn't realize that they were passing pathogens from one patient to another patient. And so a physician would move from one patient, check on their patient, go to another patient. They might go from one surgery to another surgery. They would use the same instruments, and they would wear the same clothing, and they wouldn't wash their hands between procedures. So all of this had to change, and did change with Joseph Lister. So I have this very dingy, dirty white lab coat. So the white coat is a sign of professionalism for doctors, or was a sign of professionalism. I guess most doctors, I don't know if most doctors wear them today, but I know a lot do, some don't. But in the 1800s and before, when doctors would wear these coats, they would use the coat. They would wipe their hands from one patient, like the blood, onto their coat, and this stained the coat. But instead of washing it, they would wear it as a badge of honor. And so you would have a doctor that had, tens of years of blood and microbes building up on a jacket, on their lab jacket, and then they would oftentimes pass it down to their predecessor. So they might say, you know what, you were the best student in the class, so here is my white coat. And so they would get it. So, I mean, it was a badge of honor, but it was also very likely a cause of infection in hospitals and in patients, along with not washing hands, along with not sterilizing instruments between use. So let's look at some of these terms that we have in chapter 5. Sterilization is just the removal of all microbes, so no life, as well as no viruses. So if something is sterile, it is considered free of microbes. So even sterile items, because prions are so difficult to inactivate and remove, we can't always say a sterile item is free of prions. Disinfection is the elimination of most of the pathogens in the environment. So you never know, you can't really say all, because there's always that chance that something might remain. Disinfectants then are chemicals used on inanimate objects. So we have disinfectants that are like bactericidal, fungicidal, virucidal. Anything that ends in "cide" means that it is killing. In viruses, it's inactivating, because viruses are not living. If it says static, so instead of bactericide, it says bacteriostatic, then it is inhibiting the growth. Okay, fungistatic would be inhibiting the growth. Antiseptics then are chemicals used on living tissue. So disinfectants on non-living, antiseptics on living tissue. The term decontamination is reducing the number of pathogens to a level that is deemed safe. There are multiple mechanisms for decontaminating. Sanitation then is reducing the microbes in a population to meet health standards. Preservation, we use sanitation oftentimes at restaurants. You're sanitizing the dishes that people are using. You wash them, rinse them, and sanitize them before you can reuse the same plate or knife or fork. Preservation is the process of delaying spoilage. Oftentimes we preserve using either salt or sugar or other chemicals. Pasteurization, I will say this, here's the term static again, inhibits the growth. So a lot of times we add bacteriostatics, which inhibit the growth within the preservatives. And then the term pasteurization is heating to reduce the number of spoilage organisms. So we heat milk or juices up just long enough to kill any of those microbes that could be considered disease-causing or spoilage, and then we cool the material off so that it doesn't damage the actual flavor. I'm going to stop here for this first video, and in our next video we'll talk about methods of microbial control associated with different environments or situations. Okay? Bye.